I'm Colin Natali. Now, I'm an employed spinal consultant practicing at 30 Devonshire Street, where I see patients and where I operate. Okay. Hi, I'm Colin Natali. I'm a consultant spine surgeon. I'm an employed consultant, and I see patients at 30 Devonshire Street, and I operate on them at the Princess Grace Hospital. Now, I see patients who have neck and back pain, and one of the questions people ask is, should I see an orthopaedic surgeon or should I see a neurosurgeon? And what I say to people is that you should see a surgeon who's specifically trained for spinal surgery. Now, during my training, I did total hip replacements, knee replacements, fixed fractures, but I now only deal with 32 to 35 bones in the midline known as the vertebrae. Now, the first thing you're going to ask is why somebody who deals with these bones says 32 or 35 bones. And that's because the coccyx can have multiple segments. So you've got 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar, 5 sacral vertebrae. You can have 3, 4, or 5 coccygeal vertebrae. That's a very interesting question because people who might be considering or who are studying medicine, you have to appreciate you have to work hard, you have to study hard, but because you're interacting with people, you have to love what you're doing. You have to love people, unless you're a pathologist, and then maybe you don't have to love people. So that leads you to lots of jobs. You could be a pilot, a lawyer, engineer, and of course I wanted to be all of those and an astronaut. But the thing I loved doing was I loved anatomy, I loved movement, and I had a Lego and a Meccano set as a kid. So there's a drift towards orthopaedics. I love to find out about body, and so that put medicine really high on my list. And while I was studying medicine, I did a part-time carpentry job in the evenings, which I loved. So, you know, it's really pushing me to be orthopaedics. So why spine? Now, this is going to sound really macabre, but, you know, as a spine surgeon, you have to approach the spine from the back, the side, and the front. In front, there are lots of body cavities and lots of stuff. So when you go through the neck, you move the trachea. When you go through the chest, you move the lungs, you move the heart. When you go through the abdomen, you move the bowel. So it's a really exciting part of surgery. Okay, the best thing about this is explaining what is causing the pain. It's not something mystical like your seat or your disc. The most rewarding thing is explaining something that is causing your pain. Why are you getting your pain? It's not something mystical like your seat. It's not something like your desk. And also, it's very unlikely to be something serious. What it's more likely to be due to is wear and tear, genetics and getting older. And the disc, the intervertebral disc, is avascular. It means it doesn't have a blood supply. So from the age of 15 onwards, things start to get more worn and torn. And as you get older, they get more worn and torn. The most important thing, I think, is that we can get you better. There's a saying that I use a lot, which is back pain is not just for Christmas, it's for life. So we take you through all stages of that. And one of the things that we have here, which I love, is we have a brilliant team. We have surgeons, we have physicians, we have rheumatologists, we have nerve conduction specialists, we have physiotherapists, osteopaths, chiropractors, spinal kineticists. We deal with our radiographers and our radiologists. And for most of the patients I see, surgery is actually not needed. You know, the best thing, though, that although most of the patients I see don't need surgery, what they need is an understanding of what they need. That's the most important thing. And behind me, I have a whole team. I have a clerical team, I have an IT team, I have a whole team of specialists, I have a whole team of therapists. And we're all here to do one thing. That's for you to understand what's wrong with you and to get you better. So I think the most rewarding thing is that I see patients a lot. I see a lot of patients, and we can get them better by using the whole team that we have. And if that fails, I'll either inject you or I'll operate on you. And the most important thing, I think, for a patient to understand is that it really is all about you. It's sort of, if you like, that L'Oreal moment. So the first thing is that a surgeon or doctor that sees a patient has to put them at ease. Everyone who has back pain is concerned because it's having an impact on your life. It's having an impact on your family, your leisure, impact on sleep, sitting, relaxing. But one of the things here at the specialist spine unit is that we have all the diagnostic kit we need. We have X-rays, we have MRI scans, we have SPECT CTs, which are specialist forms of CT scans. And we have a network of specialists who we know and we meet regularly. So what you'll expect is I will take a history from you, I'll examine you and order the appropriate special investigations. And at the end of that, when we meet again, I'll give you your diagnosis and I'll give you a treatment plan. If we have difficult cases, we have, and if those difficult cases we're not sure what we need to do, we also use MDT meetings. Now, these are multidisciplinary team meetings. And what we do here is we have radiologists, rheumatologists, spinal kineticists, physiotherapists, surgeons. We have everybody in the team who meet together and discuss your case. And the importance of that is it's the power of brains. So you have lots of brains focusing in on your problem and coming up with a solution. So you see, seeing a surgeon doesn't mean you have an operation. What it means is that you have the best possible care for something that is going to keep bothering you, because remember, back pain is not just for life. Because remember, back pain is not just for Christmas, it's for life. So what you've got behind you is a massive team that are dedicated to getting you better and allowing you to live your life.